Hi, how are you?
Good. All right, for those of you guys who do not know who Bria is, she's going to give you a quick intro of who she is, what she does, and all the amazing things that she does for our community.
Yes, hi, I'm Bria. I live in Minneapolis and I am a mom of two girls. And I'm married to the video gamer that you just saw on the screen, so sorry about that. I am a doula, which is basically a labor coach for people who are pregnant, in labor, giving birth, or postpartum.
Awesome. Cool. And
Yeah.
I met Bria one through Instagram, and then we chatted. She came to the clinic and we chatted a few weeks ago, and that was fun to see a real life person
I
while we are in
know.
quarantine. For those of you who do not know, I am Dr. Crystal Vang. I am a pediatric and women's health chiropractor in Blaine. So we see a lot of pregnant mamas, and we're very blessed to be a part of their prenatal journey from start to finish, even into postpartum. And we see a lot of mamas, a lot of them for wellness because they understand that chiropractic is great for pregnancy, but a lot of them for low back pain and sciatica, which is a huge problem that a lot of moms think that they have to live with for the whole entire pregnancy, which they don't. And so we see low back pain symptoms in our pregnant mamas, but a lot of it is because your body is changing so much, right? And we expect that there's some aches and pains because you're growing a baby, and that's an amazing thing that you're doing. But sometimes you just need a little bit of support. I had a mom come in the other day with sciatica problems, and she could barely walk in. My heart felt for her. And sciatica problems are symptoms, they could be shooting, throbbing pain into the butt and then into the leg. And that is very common in pregnancy, but it's not normal, right? And Bria, you and I have
Yeah.
talked about that.
I say that all the time too. Just because something's common doesn't mean it's normal. It doesn't mean you have to live with it. Just
Mhm.
because all of your friends experience it doesn't mean you have to live with it.
Yes, so true, so true. So we see a lot of mamas for sciatica during pregnancy, and one of the best things to do for sciatica is one to stretch your glutes and piriformis muscles, but also to balance out your pelvis and all those muscles and ligaments that are around that, and that's what chiropractic excels at. We do specific techniques that we'll talk about in a little bit, but we'll do specific techniques. We work on specific ligaments and muscles so that we can help everything be relaxed and as balanced out as it can be so that your pelvis can receive baby when it's time.
I love that.
Yeah. And then Bria, do you want to talk about your squatting that you were telling me?
Yeah. So one of the things that I 100% recommend that every single person do while they're pregnant is squatting. And what I mean by this is both types of squats that you might be thinking. So you might be thinking like the workout type of squat to like gain muscle, and that one is fantastic because labor is a marathon and you need to train for it. But what I'm really referring to is more of the yogi squat. So think of the most flexible person you know, or maybe a toddler, how they will just squat down and their heels stay on the ground and they're just super comfortable sitting like that. That's where we want to get you to while you're pregnant. And so there's ways to build up to that type of flexibility. And one thing that I really recommend is while you're watching TV at night, sit on a yogi bolster or on a pretty thick cushion or whatever you've got laying around and start to practice sitting comfortably with your legs wide to begin to open up your hips. And you can even like sit against a couch, like if you're on the floor and the couch is behind you, and then put your partner or your best friend or whoever on the couch and have them give you a little back rub while you're doing this. Highly recommend. Um, but all of those things are going to help your body to start to open up because human bodies, human pelvises are not made for human brains. It's a tight squeeze through that birth canal. So the more work we can do in pregnancy to enable that flexibility, we're going to set ourselves up for better success in labor.
Mhm. And and I would say to start squatting even before you're starting the show, right? Because a lot of
Oh
times
yeah.
mamas will wait until, they're like at the end of their third trimester to start doing all of these things when we really want them to be doing it from the get-go.
Yeah. And even if that position doesn't feel comfortable, it's okay, you can get there. But rather than leaning back on the couch watching TV, sit up on the front of the couch and sit forward, so that at least we're working on moving baby forward and using gravity to our advantage. Wide knees open up that pelvis.
Mm-hmm, for sure. Can you talk about the rebozo that you're saying, like the different
Yeah.
wrapping and tying technique?
Yeah. So a rebozo is a traditional Mexican garment. This is something very important to that culture. And here in the US and across the world, people have started to use the rebozo differently. And a lot of times a rebozo can be substituted with a ring sling, a scarf, any long, large piece of fabric can work as a makeshift rebozo. So I often use a ring sling. And what I'll do with pregnant people to support their bellies is tie the ring sling around the bottom of their belly and then tie it up tight in the middle of their back. And this just gives their belly like a little bit of a lift in pregnancy, and can often provide a lot of support for all of that extra weight. On the flip side, if the pregnant person is having hip pain, I like to do it the other way. So I start at their back and tie it around their back and bring it forward, wrap it fully around their hips to kind of squeeze them together for support, and then tie a big knot under their big pregnant belly.
Mm-hmm. And that totally makes sense, because how many pregnant ladies do you see walking around Target and they're literally holding their belly up, right? Because towards the end of pregnancy, their belly gets so heavy that they just want to keep holding it.
And there are products on the market, baby belts. They're fantastic, but they're often $100 or more, which can be really limiting to a lot of people. You don't need a baby belt. If you can afford one and want to buy one, great, I'm all for it. But grab a really big scarf. We all live in Minnesota. Everybody has scarves laying around.
Yeah.
Use that, tie it up, see if it works just as well.
Yeah, and I love that you said you can use like a baby ring sling, right? Because you said, and then you can use it when baby's here. So
exactly.
I love it.
Double use.
For sure. One of the things I wanted to talk to you guys about too, that a lot of our pregnant moms have a problem with, is swelling during pregnancy, especially during the third trimester. So there's a lot of swelling in the hands. A lot of pregnant mamas stop wearing their wedding rings because there's so much swelling, and then the feet and those wonderful kinkles show up. And it becomes an issue when it's coupled with other things, right? Because we're thinking preeclampsia. But whether it's preeclampsia or just swelling, one of the I guess 3 things that I would say for swelling that you should do to help is, one is eat enough protein. A lot of us are not eating enough protein, and so my recommendation is to get as close to 100 grams of protein a day. And if you think about how much you currently eat, it's a lot, right? So I literally have moms just journal and see how much protein intake they normally take in, and usually it's about like 50 to 60 grams is what most of my mamas end up regularly doing. And then we ask them to up that to 100 grams. And so that doesn't mean that you just eat meat, but it means cottage cheese and eggs. And, if you want to go to town on a steak, go ahead. But you still want to add in the other things that are a little bit easier to digest and to get in. So 100 grams of protein is one of my recommendations for swelling. And then magnesium. So magnesium supplements are awesome. They're very cheap. If you eat even good quality magnesium is still very affordable. And then I also say Epsom salts baths. And a lot of our moms are not first-time moms, so they'll look at me and they're like, you want me to take a 20-minute bath with a 2-year-old? Like, that's just not going to happen. And so I tell them to do foot baths. So just get a bucket, put Epsom salt on it, and then just plop down in the living room while your kiddos are running around, watching TV, whatever it is. But at least I get some time in the Epsom salt bath.
I love that.
Yeah, and so the third thing for swelling is chiropractic. So chiropractic is all about the nervous system, and it's all about balancing out your the function of your nervous system. And when that is balanced out and working at its most optimal, it helps to improve lymphatic flow. And lymphatic flow is what it's all about water retention and moving fluids in your body. And so that's really, really good for lymphatic flow and making sure that you're not retaining as much water.
I love that you mentioned protein because I think that's something that a lot of people don't realize that they need a ton of in pregnancy. And for people who are in the midwifery model of care, midwives do exactly what you do. They have people chart everything that they're eating. But in the US, only 10% of babies are born caught by midwives. So if you're seeing an OB, probably that type of holistic care is falling through the cracks a little bit. And so I love that you do that to be able to help catch some of those patients.
Yeah,
But
and when you think about preeclampsia too, so the three factors in preeclampsia are swelling, high blood pressure, and then protein in the urine. So when moms hear that, they say, oh, well, I can't eat a lot of protein because then there'll be protein in my urine. Whereas it's actually the opposite. When you eat enough protein, it helps to prevent preeclampsia and swelling, right? So there's
yeah,
there's such a misconception there.
for sure. The other thing that protein really helps with is morning sickness and nausea in the first trimester.
Mm-hmm.
So I know for me, at least in my pregnancies, when I felt that, my instinct was to like grab carbs, but they never helped me feel better. And if I could like choke down a hard-boiled egg, I'd feel so much better in the long run because it was my body just screaming for that protein.
Yeah. And I love to tell moms to eat cottage cheese because a lot of them will be like, I can't eat 4 eggs in a day. Like cottage cheese is one of the easiest things to just chow down on.
Yeah.
So that's a really good one.
Or super high protein Greek yogurt.
Mm-hmm.
It just make sure it doesn't come with like high amounts of sugar as well.
That's so true. So true. For those who are watching live, if you guys have any questions about pregnancy, what we're talking about, just make sure you drop them in the chat or in the questions area. Let's see. Okay, so one of the things that chiropractors can do in terms of balancing out the pelvis and getting everything ready for labor and delivery is called the Webster technique. And the Webster technique is it's talked about in terms of pregnancy, but we can actually use the technique for anybody, whether it's a non-pregnant woman or if it's a male. It's just a way for us to analyze the pelvis and all the soft tissue, ligaments, and muscles that are around the pelvis. But it's so important during pregnancy to make sure that your pelvis is aligned because baby positioning is not random. If your baby is breached for a reason. It didn't just randomly get breached, right? It's all about the anatomy. So if chiropractors use the Webster technique to make sure that the pelvis is aligned and there's enough room for baby to move. I do a lot of what's called soft tissue neurology. So if you see me adjust a pregnant mama, at the end of her visit, she'll be on her back and I'll gently tap the belly like this because when you're pregnant, that's the one time that you want your belly to be nice, soft, and jiggly. So that's what I tell my moms. I'm like, I know that you don't want to hear this, but I love it when your belly is jiggly because that means that the soft tissue is nice and relaxed. And when your belly and your soft tissue is nice and relaxed, that gives room for baby to move. So a lot of my pregnant moms will say, oh, after I get adjusted, my belly feels lighter.
Interesting.
Right? Yeah, and so they'll say that their belly gets lighter and they feel that baby is lower because now that everything is relaxed, baby's moving around a little bit more.
Yeah, I love that. Go ahead.
Yeah. I think that's all I was going to say. Go ahead.
Yeah, did you want to move into back labor and delay of labor?
Yeah. Mm-hmm.
Okay. So one thing with malpositioned babies that you were just referring to, sometimes when we actually get to labor, 2 of the symptoms that we can see of a malpositioned baby is either back labor or delay in active labor, meaning that your contractions are coming really close together, we're moving along, we're making progress, and all of a sudden they just kind of stop. And it's your body's way of saying like, hey, something's not right, baby's not ready to come out yet. And same with back labor. because in general, most people are going to feel contractions in their stomach. Every once in a while, you get a person who feels all types of reproductive stuff in their back. And so they may feel menstrual cramps, all Braxton Hicks, all labor contractions in their back. That's not what we're talking about. We're talking about people who usually feel these types of things, menstrual cramps, stuff like that, in their front, and all of a sudden they're feeling everything in their back. Usually what that means is that baby's malpositioned, and baby might be what's sunny side up, which means that they're coming backwards from what they need to, so the back of their head is rubbing against the back of the pregnant person's pelvis, and that bone on bone can be really painful. So there's a couple things that we can do. First of all, we want to get that baby repositioned. So this is where Dr. Crystal comes in, because you can actually call a chiropractor in labor. So if you want to tell about that a little bit.
Yeah, so a lot of chiropractors who specialize in prenatal care, well, I guess I should say some chiropractors, depends on your chiropractor. But for myself, when my mamas are closer to delivering, I will give them my cell phone number, and I will tell them, like, hey, if you want me to be at your birth, just call me in the middle of the night and I'll be there. And the biggest reasons is that when we see that birth, labor has been going on, contractions are going, and all of a sudden things stall. Right. So chiropractic is awesome at helping to get things moving, because one, we are calming down mom's nervous system. So sometimes it could be that mom is so stressed out that it completely stalls everything. Because when you're stressed out, your body says, we're not ready to do this because we're so stressed out. And
for sure.
And so chiropractic can help get you out of that stressful fight or flight mode. And then we also go in and we do the Webster technique. We analyze the pelvis. We make sure that things are nice and balanced out so baby can get into a good position so that labor can continue.
Love that. For people who don't have access to a chiropractor on call, although I think I'll be calling you if I ever have a third, there's some things that anyone can help you with in labor. So what I usually recommend is that the pregnant person get on hands and knees and then bring their butt up and their head down. Because what we actually want to do to reposition a malpositioned baby is get them kind of out of the pelvis so that they can try again. And so there's a couple things you can do. First, get into that position. And then you can take that rebozo that you used for supporting your belly in labor, and you can wrap it around the pregnant belly and hold it up, have a support person holding it up, and shift and sift the pregnant belly to kind of help baby move a little bit. You can try lunging. Lunging is great for strength in pregnancy, for getting labor kind of going when you're almost ready to have the baby, and then for repositioning a baby. So you might I'm not talking about like lunging with dumbbells in the gym, but you might have a really steady chair or a couple stairs, and you might stand up with 1 foot higher, 1 foot lower, and then just kind of move, rocking back and forth in that position. And then try the other leg and try it during contractions to see if baby moves. And I'll tell you, anyone who has experienced back labor will tell you it is painful. So the best thing that your support people can do is know pain relief techniques for you, especially if you're not interested in medicine. There are so many things that we can do to help with that back labor pain. Get on all fours, put that butt up again, and flip your rebozo over the butt and pull it down and put that pressure on the hips. Or take 2 people, one on either side of the pregnant person's hips, and squeeze them together. Or take a really cold can, like a pop can, and roll it on the pregnant person's back. There's so many different things that we can try and do to help people get through that. And then ultimately, for people who want an epidural, a lot of these things are still options, even if you have an epidural. So squatting while in labor is completely possible in a hospital with an epidural, because hospitals have these really cool beds. This is like the biggest benefit of hospitals, is some of these really cool tools that they have available. So they've got these beds that if you think normal bed, like person's got their head here, feet here, there's a break in the bed. So they can lower it. So now all of a sudden my little pen person can do a squat in the bed with their butt up here and their feet down here, and they can bring a bar over for you to hang on to. And so a lot of these things are options. Just because you have medication or you have a hospital birth or you have X, Y, and Z doesn't mean you don't have options. It just means that you need to hire the professionals who can help you open the door, open the book to all of your options.
Yeah, and I was just going to say that's one of the biggest reasons when you're talking about all the labor back pain and the rebozo and squeezing the hips. That's one of the reasons why you should hire a doula, because yes, your significant other can learn how to do those things in your prenatal classes, but the honest truth is when you are in labor, you mentally are not there. Your spouse is mentally not there. Your significant other can't remember what to do, and that's why you have a doula there that can help you. They are there to support you and your significant other.
Oh, completely. Yeah, my husband says that if we have another baby, like he wants 2 doulas for himself. And it's true, because you get to a point in labor when you're the laboring person where you are a mix between a wild animal and a small toddler. You are not a functioning adult in labor. Mm-hmm. And you can't make those types of decisions, and you can't remember anything that's going on. And ultimately, you also oftentimes can't really express what you want or need. And so you need people telling you, do you want this? Yes. Do you want that? No. It's yes and no is pretty much all you can say when you're in labor.
Yeah, and I love that doulas don't replace the husband or the spouse or the wife that's there to support the laboring person. I think that's one of the biggest misconceptions, is that a doula will come in and they're supposed to take the place of the significant other.
Yeah, not at all. The significant other plays such a huge role because they love this person and they know their person. You know, they know, oh my gosh, this person hates to be touched on their butt, or whatever it is that I might not know as the doula. And so we work together to be the total birth team. One of my favorite analogies is if you want to go climb Mount Everest with your spouse and you think it's going to be this intimate trip, and you guys are going to get through it together, and it's a big challenge, and you're excited to take it on together. But ultimately, neither of you has climbed Mount Everest, and neither of you really knows anything about mountain climbing. And so you hire a Sherpa. And that makes sense, because if something goes wrong, the Sherpa is going to help you assess the problem. They're going to help you come up with solutions, and they're going to give everyone the tools that they need to succeed in climbing this mountain. That's the doula in birth. You hire a doula to help you both navigate the waters of birth.
Yeah. And one of the things I always tell my patients is that your prenatal team has to be supportive of all your choices, right?
Yes.
And that's one of the reasons why when patients come in, I ask them like, hey, do you have a doula? Like, are you gonna deliver with an OB or a midwife? Where are you delivering? Because we want to also be part of that. We want to make sure that everybody knows what's going on. Everybody knows what our patients' choices are. We have a very holistic practice, but I'm also very supportive of patients who just say like, you know what, I had a horrible first, I'm gonna do a C-section, it's planned out already. I want to make sure that I just support my patients and whatever they have chosen to do with their labor plan and whether it's prenatal. So being a part of their prenatal team is so important because the support starts from the get-go, not, you know, and so we have a lot of moms who will say like, oh my gosh, I will never do pregnancy without chiropractic care ever again. Like, I don't know how other women do it. You know, we have women who have come in with, one of our patients, she's had low back pain for 10 years. She got pregnant and now it's horrible and it went away in 3 visits. You know, and,
I love that.
So that's just amazing. And so, and I love that, from a doula standpoint, you and I were talking and we said like, oh my gosh, like, no pregnant woman should ever go without prenatal chiropractic or without a doula. Like, that's just, in the perfect world, everybody would have those 2 people on their prenatal team.
100%, yeah. So I personally believe that having a doula is actually a public health priority. And I know that a lot of my doula friends believe the same. And so I encourage people who are looking for a doula to interview 3, at least. If you don't like the first 3, then keep going. And oftentimes I'll have people come to me and say, but I like you. I feel like we get along. I'm like, okay, but who else are you interviewing? And they're like, why are you letting business walk out the door? But it really matters, because if we don't click personally, then I'm not the best person for you in labor when you're that mix of a wild animal and a small toddler. You're not going to like me. And you need to feel 100% supported by me. And so if we talk for half an hour and I give you the impression that I don't support one bit of your birth plan, go interview another doula. There's somebody out there for everybody. There's a good fit for everybody.
Yeah, and I love that you do that. That you tell, even if they know that they want you, that you tell them to go explore their other options, because that tells me that you put your client and that pregnant woman's needs and wants before yours, which is what every practitioner should be doing.
Yeah,
right?
100%.
So when would you say that a couple should start interviewing a doula? At what, like, trimester a week?
Yeah, I would say anytime, really. The most support that I'm going to give you is probably in the 3rd trimester, but it really depends on who you are as a person. If you get that positive pregnancy test and feel really anxious and overwhelmed and aren't sure if you need a midwife or an OB or what, give me a call, because it's my job to present options to you. And so we can talk through, if you're 6 weeks pregnant, we can talk through what your options are in the Twin Cities for giving birth. You can give birth at home, you can give birth in a hospital, but there's also this middle ground. There's this freestanding birth center. Have you heard of those? And so I find it really useful to start working with people really early on in pregnancy. But I've also had clients who hire me after the baby is born. So they went through the entire pregnancy, the entire labor and birth without a doula support. Then they got home, baby's 3 days old, and they're like, I don't know what to do. So hire me then. And I've come into people's homes and done meal prep and help with breastfeeding and found resources and taught baby wearing, all of those things that you need in the first week. I do that too. So there's really no right or wrong answer. It's whenever you feel like you want support to start. And my birth doula package is actually just a flat fee. And so whether you hire me at 6 weeks or you hire me at 38 weeks, it's the same price. So you might as well hire me early.
Yeah, so true. Because you need, and I think that even if you have gone through labor and pregnancy and you have, 1 or 2 children already, and this might not be your first pregnancy, I still think that you need somebody who is an expert in birth and pregnancy to be there, to be one of your resources, because every experience is so different.
Yeah, 100%. You never know what's going to happen.
Yeah,
in birth.
For sure. So in terms of prenatal chiropractic, we end up seeing, if a patient has never heard about prenatal chiropractic, we tend to get them later during the pregnancy. So like 3rd trimester, when they are like 37 weeks and baby is breech, and their doula or the midwife or OB will say like, oh, maybe you should try chiropractic. And sometimes we get, the pelvis aligned and baby moves into a more optimal position. But I always tell patients, like, get in as early as you can, because just like we were saying, the stretching and sitting, doing squats and opening the hips early on during pregnancy, we want to be able to help balance the nervous system, the pelvis, and the soft tissue early on during the pregnancy, so that as you get closer to labor and delivery, we're not running into issues where maybe baby's not positioned as optimally as possible, or, so that you don't have to go through severe pain that we then have to basically reverse, right? So we want to keep you comfortable in your pregnancy from the get-go, from when you first find out to postpartum. I'm just going to read this really quick. So Veronica said, I love hearing about the squats. She's in her 2nd pregnancy. She'd love to hear about other ways to make labor go smoothly. So Veronica, we just went through a lot of stuff about labor and delivery and making sure that your pregnancy journey sets the tone for an awesome labor and delivery. So if you have any questions after you watch the whole video, let us know. You can message us. Okay, so Bria, where can they find you on Instagram?
So my Instagram handle is bria.the.doula. And then from there, the link in my bio has the link to my website and everything else. But feel free to reach out at any time. I love chatting with people on Instagram.
Awesome. Awesome. And I
Yeah.
found Bria on Instagram. She has these cute little, what are they called again? The little
Oh, the
Lego.
Playmobil.
Yes, the Playmobil, which is they're very well done. I'm very impressed by them and so much good information that you're putting out there in those posts.
Thank you. Yeah, we got to start those up again.
Yeah. All right. Well, if you guys have any questions, let us know. We will be saving this onto IGTV. So if you are looking for a doula, reach out to Bria. We are here for your prenatal chiropractic needs if you need. So let us know. All right.
Thank you so much for having me.
Bye, Bria.
Have a good evening.